You're listening to Healthcare Now Radio. Stand by for This Just In, the latest in healthcare innovation and technology trends with your HIT advisor, Justin Barnes.
Thank you for tuning in, and welcome to a special episode of This Just In Radio Show on Business Radio X. I'm your host, Justin Barnes, and I'll be bringing you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. And for this episode, my 150th episode, we have a special guest, Will Hall, CEO of a very cool Georgia-based company called HIPnation. Welcome to the show, Will.
Thanks, Justin. Appreciate it so much.
Great to have you here. And I first learned about HIPnation, what you guys were doing, from a great mutual friend, Ross Mason. He's just a beloved local entrepreneur here in Atlanta. And from the moment I heard about your company and the healthcare service offering, I just got very excited. Not only what you guys are doing, and not only as a consumer, but as a small business owner and entrepreneur. But I don't want to steal any of the show's thunder. Let's dive right in. So tell us a little bit about you and where you come from and your background.
Well, first, I'm certainly appreciative of Ross making the introduction. I remember as we were talking, he said, gosh, you've got to meet Justin Barnes. He'll be interested in what you were doing. So that was fun. So me, I am a physical therapist by training, treated patients for 10 years, and just thought that was the greatest job in the world. I love to intersect with patients. So I'm a caregiver at heart. My career went for about the next 10 years on the business operations, leadership, management side. So I did that for about 20 years, and then I intersected with the guys that started this company about a little over 2 years ago. And it was a consulting company with the idea to truly transform the way healthcare is delivered in the country. And sat down with one of the founders who drew it out and said, hey, we think this is how you can fix medicine, get people great care, make doctors happy again, and let them take great care of patients. And so I get to bring the caregiver side of what we're doing and also the business side.
Yeah, no, fantastic. So tell us a little bit about HIPnation and where the concept come from and why you're so passionate about it.
Well, I think the caregiver part of getting to take care of patients, and I get to hear the stories every day of what we're doing in the lives of patients and our physicians. So that is fantastic. But ultimately, the concept came from 3 treating physicians in Atlanta. And these guys were authors. They had written books on healthcare economics. They were the speakers on Capitol Hill. They were speakers on talking heads on the radio stations and the news stations, and saying the way to fix healthcare is ultimately what we've done with HIPnation. And so those guys were trying to build an entire system and innovate something that is really big. Everybody has a story about how it doesn't work. And so I got to intersect with those guys and look at the system. I'm a consumer as well as a caregiver, taking care of patients. And so when I looked at that and thought what we can bring to the market was very intriguing. So I am passionate. I get to hear physicians who send me a text and say, hey, I've had more joy in medicine in 6 months than in 15 years. When you can do that and you get patients, I talked to a gentleman the other day, said that's the best appointment I've ever had in medicine.
Yeah.
That can get you going every day.
Yeah, and I want to dive into a story also later on that you told me this morning when we were kind of talking about the show and getting ready for the show. But I was extremely excited. I think we met, I think it was last week, we were speaking and you mentioned Dr. Rob Herrera, who I have a fantastic primary care doctor today. I'm still going to switch to HIPnation because the service is so compelling. But 15 years ago, Dr. Herrera was my primary care doctor.
Oh, wow. And
he was the best doctor I had ever had at that point. And he's about to be my best doctor again. But he took such great care of me. His, I guess, quote unquote, his bedside manner is fantastic. His style of treatment and the way he was preventive and the way he set up his practice, even 10 years ago, 15 years ago, was always forward thinking. And me being in healthcare, me being on the IT side, engaging consumerism, seeing how consumerism was starting to shape healthcare, accessing all the policy aspects of that, and also being excited for that. We need consumers in healthcare. We are not just patients. We are buyers. We are consumers of healthcare.
Right.
And we deserve a lot more at a better value.
Absolutely. Well, how it all comes around, you had heard about him. I used to take care of his patients as a physical therapist. I remember taking care of his folks, and I've talked to him. And patients talk about their physicians, the ones they love, and probably the ones they don't. But I remember his name because patient after patient talked about what a great doctor he was. And so when I first got to meet him, I told him, I was like, I know you don't know me, but I used to take care of your patients. Yeah. And so I knew that name. It's fun how it all comes around. And I just talked to a patient yesterday. She told me he saved my life. You know? And so you get to intersect and hear those stories of what he's done. And, you know, he doesn't toot his own horn, but the guy's an amazing physician.
Well, I can actually pile on that. I didn't talk about this before, but he also saved my life. And I'll tell you why. He told me 12 years ago that I had an elevated blood pressure. And he's like, you've got to keep an eye on that. And he told me at that time, I would like you to walk around with a monitor for a couple of weeks. I was too stubborn. I was working a million miles an hour. Sure. We were building our company. Yep. And then my health plan changed, and he was no longer on my insurance. And that's the only reason I left Dr. Herrera was because he wasn't on my insurance any longer. And then I got shuffled around and had to go find, and thankfully, I did find a new primary care doctor. My costs have gone way up dramatically.
Right.
But I could afford it, and so I was paying it. However, now since he's back on your service, but my point there is about 6 years ago, I had remembered what Dr. Herrera had said to me, and I could tell my blood pressure was too high. I could just feel it in just in my daily activities. Right. And his voice was always in the back of my head. And so 6 years ago, I went to see my cardiologist. I actually went and got a cardiologist and told him my story. And I've been on blood pressure meds ever since. And now everything's managed and I exercise and everything's great. Right. But Dr. Herrera was in the back of my head for 10 years or 5 years leading up to me going, 6 years leading up to going to see the doctor. So, but let's dive in a little bit about, because I mean, I know I'm talking very fast. I am more passionate about HIPnation potentially than you are. I know I'm not, but I love because when I heard about your service from Ross, and then I saw the cost structure and how affordable it was and how proactive instead of reactive care, you guys are living and breathing everything that I was talking about in the speaking circuit, what I was trying to create with my companies, and just when I advise other constituencies about healthcare, you guys are delivering what I talk about. Right. So when we kind of came together, and Ross saw all that.
Sure.
And, Ross is also prophetic in some ways, and I think we both know that.
Right.
But let's talk a little bit about your healthcare service packages, because I know you guys don't describe it the way I do. I try to simplify everything, and I said you basically have 4 packages, but you correctly suggested we have 1 package. We have our HIPnation, and then we offer 4 different other wraparounds. So talk about that, because I want to make sure what I'm most excited about is say there are 4 to 6 million people that can hear our voices right now, and half of them would be perfect customers or consumers of HIPnation. And so I kind of want to reach them because I know me, and I don't want to jump the gun, but me as a CEO, me as a small business owner, me as a consumer, you're right in my wheelhouse and where I want to consume healthcare. So please tell us about your service offerings.
Right. Well, HIPnation is healthcare. It is fantastic healthcare for about 90% of your needs. We have about a 10% chance of accessing a hospital. So we'll talk about those 4 segments. But HIPnation is it's a healthcare solution, 24/7 access to phenomenal primary care physicians.
Like Dr. Herrera.
Just like Dr. Herrera, who take amazing care of folks. And when you give a patient a relationship with that physician and you fix a system that gives the physician a relationship with the patient, the care is unbelievable. And so that's what HIPnation is. It's a full healthcare solution for $100 a month. Folks can sign up on HIPnation.com and you're an immediate member. You get your physician's cell phone. And then what we saw is there needs to be an insurance answer for folks for that 10% of chance that you're going to be in a hospital. You've got a high dollar, low frequency event. So we went out to the market and we've looked at it. And so we have members that use one of the sharing ministries, MetaShare, Liberty Share, and they pair that with HIPnation. So they take HIPnation, put themselves, their small business on it, and then they bring in MetaShare, and that becomes their catastrophic insurance. Yeah. We have a lot of Medicare members because there's so many changes with Medicare now. Some physicians are opting out and things like that. So we have Medicare members who are joining HIPnation because now they've got fantastic health care. And then when they access the higher dollar system, Medicare is their payer for those catastrophic things. We have members that are on a group insurance plan through their employer, or they're the business owner and they're paying for that group insurance plan. And so they pair that with HIPnation because of the care. That's the difference. We have a lot of folks that have been priced out of the market and they've gone without insurance. They've had nothing for years. Right. They hear about HIPnation and they come in and like, okay, this is 90% of my health care for $100 per month. I've had folks say, gosh, I pay more than that for my cell phone.
Right.
And so that really is the segments, individuals and small businesses, we've got great answers for them. And we partner it as well with an indemnity-based product. It's kind of the old insurance, the way insurance kind of used to be. We partner that as well. Folks have a no-deductible option and $1 million of coverage per year. They partner that with HIPnation, and now they're compliant with the individual mandate as an individual, as a small business owner. So those 4 segments, pairing HIPnation works fantastic, and we take great care of folks. People get better. They save a lot of money.
Yeah, I mean, just to give my example, and I think this could be indicative of millions that can hear our voice right now. But I mean, I think I'd pay $100 a month for HIPnation, unlimited primary care, access to telehealth, everything that I would need for the best care possible on the planet. And then I pay I have MediShare, for example, so I pay $216 for my wife and I.
Right.
So I pay $416 for the most premium proactive care on the planet.
You got it. And it's telehealth. It's telehealth with your physician.
Exactly.
You're
That's right.
You're not calling an 800 number, and there's some good parts of that, but you are calling your physician's cell phone. We send you an ID card with your doc's cell phone and say, Justin, put Dr. Herrera's number in your phone, and you've got a question, you call your physician. That's a game changer. And I do the same thing. I use MediShare and HIPnation for my family. I have a wife and 2 kids. I believe in this. Yeah. The care is phenomenal.
Yeah, no, this is like I said, I get very excited because when I went out to the exchange, it was no less than $1,000 for us. Now with open enrollment coming in late 18 here, we're going to have more increases, I'm sure, another 10, who knows, 10, 15, 20% increases. So now it goes from $1,000 to $1,200 a month. So I can for $400 a month or $1,200 a month.
Exactly.
And that's what I'm saying. And most of my friends are CEOs or small business owners, and they are all struggling with healthcare costs for their employees. And so this is an option, and again, I don't want to jump ahead because I get very excited about this stuff, but let's talk about it though, specifically to see if we can help people. Who do you target today, and who do you see? I call it ideal client profile, ICP, but who is your ideal client today or ideal customer today?
What we have found, and since open enrollment, like you said, the increases were north of 30%. And so our ideal client right now is the small business owner that's really been priced out of the market. So they have less than 30 employees, and they're either priced out and they provide nothing. So then they're becoming a recruiting disadvantage and retention. That's a problem for them. Or they've been priced out and they give their employees $200 or $300 a month and say, go to the market. Well, if it's $300 a month and I have a family of 4 and it's $2,200, they can't fund the other part of that. Yeah. And so that small business owner, 30 employees and less, the individual that's thinking about going out on their own. We had a great story with this gentleman that left a really big company, and he said the final piece of the puzzle, he's trying to figure out healthcare for his family, and HIPnation was the answer. So he's able to go out, start a small business because he had the answer now. Yeah. So it's an individual that's had no coverage. Actually the rates of uninsured are going up because of the prices. So that individual, small business owner, 20, 30 folks, 5, 10, 15, we are signing those folks up every week, and now they're able to bring amazing health care at a price they just didn't even know was possible. Yeah,
no, it's 40, 50, 60% less than the exchange.
And
also those costs are all going up dramatically.
Absolutely. Yeah. So I talked to a small business owner who signed up, and that's what he said. He said, it's the one thing on my P&L, the one line item that I cannot control, and I dread opening the increase.
Right.
He's like, I get the increase, and I dread opening to see what the percentage is going to be. He said, I can control so much in my business. I can be forward thinking about it. But then this comes, and I just have no control.
Yeah, no, and I literally was just down at the Atlanta Tech Village, ATV, here in Atlanta. I was an EIR, entrepreneur in residence, at the ATDC, which is another incubator at Georgia Tech. And literally, I was just at the ATV last week, though, and one of the CEOs, his biggest struggle is healthcare costs. That's because he's going through a round of funding. He's got enough for everything he needs to do. Like you just said, he can predict every aspect of his business, but he cannot predict the healthcare. The healthcare amount.
Sure.
What's going to come for 2019.
Absolutely.
And and it was a very stressful process for him because you have to look at shrinking down other aspects of your business. And as an entrepreneur, you're looking to expand.
Right.
You're not trying to, what can I cut just to make sure I have enough
Exactly.
and I don't go bankrupt with my healthcare expenses. And, so.
I just had a meeting earlier today with a group, and they were talking about some fast growth companies in Atlanta, 75, 80, 100 people right now, predicting that they'll be at 300 people in 24 months. And I said, the issue is, if you're going to add 200 people, you've got to think, You know,
millions
the stats
more
are,
in
it's
healthcare
about
costs.
$10K a year, if you just kind of take a mid-range per employee.
Yeah.
So you got to think, I'm going to add 200 people in the next 24 months, and each of those is $10K a year. How much can I take as a business owner? How much can I give to the employer? And then we were talking about that. When you're talking about investment, if you can get a multiple and save that, you save $5, you save a multiple of 10.
That's right.
And so that's what someone said. This is great in a portfolio for a company to be able to come in and say, hey, we'll put this in all of our portfolios.
That's right.
I have better care. I've got my dollars go a lot farther. Ultimately the company's more successful. It helps with recruiting. Instead of throwing dollars into healthcare, you hire more people that are talented to grow the company. Just so many things where companies can win.
Yeah, no, and that's exactly. I think when I was going through the concept with you guys, if I want to bring this to groups like Fulcrum Equity Partners and Norm Mosley here in Atlanta, these are private equity groups, investors that want their companies to thrive and have streamlined, limit their cost to the best of their ability, so they can invest in growth, not operational infrastructure costs. And you guys can go. I mean, I know we've talked about this offline a little bit. You can go as high as, say, 50 employees and 60 employees, but your target is really 30 employees and below, the smaller businesses, and they are the ones who are struggling the very, very most.
Absolutely. When we talk to those business owners, we kind of use the term, they're in a corner with just really no options, and they have no idea that there's someone out there that's forward thinking about how to give great care, how to help them manage their cost. And we love the term thrive because we think
that's my term too.
Yeah, we love it. When an employee can thrive because they're healthier, that helps the business thrive. You get engagement of a company. There's no limits to what they can do, but if you have that business owner who's thinking, gosh, what is my increase going to be? Am I going to have to, shrink my workforce or whatever? So we love that term, and we see it when patients get connected to our physicians, they thrive.
Yeah.
It's been fun to see.
That's awesome. Yeah, no, my slogan when I do my public speaking is, if you're going to sit in front of me, I don't want you just to survive in healthcare. I want you to thrive in healthcare.
Absolutely.
So that's
I love it.
Great. So talk about really your service area. Where do you guys focus your efforts right now? Obviously, you're around Atlanta, but where do you offer your package, and then also, where do you expect to expand to?
Yeah, we're an Atlanta-based company at this point. You think about that's 5-6 million folks for sure. And so we go from Cumming, Georgia, all the way down to Tyrone and Peachtree City and kind of everywhere in between. So we have about 8 clinics at the moment, with our 9th opening in a couple of months. But we're in Cumming, Johns Creek, Roswell, Sandy Springs, Dunwoody, Brookhaven, Tyrone, and Decula. We'll open Duluth right outside of the Gwinnett Arena in the first part of July. So we're really excited about that clinic as well. So that's Atlanta. We have physicians, because of the reach of our founders, we have physicians all over the state, all over the country who are saying, bring HIPnation. So we will be in Athens, Macon, and Savannah by the end of this year. We already have physicians saying, you've got to come. We love this.
Yeah.
And then outside of that, we have physicians in Texas, Alabama, and Tennessee who said, hey, bring the model. One of the things I've learned is we all have a story as a consumer, but the thing that I've learned is the physicians, the story, the system just doesn't work, and imagine investing the time and money and energy into medical school and residency and all those things, and then getting into a system that does not allow you to be a caregiver. So they're starving for something different. So the physicians love taking part of this.
Well, so talk about, when we were speaking this morning and just getting ready for the show, you mentioned your mission statement and some of your not codes, but codes for the company. And you guys went through this with one of your doctors, and they broke down. So just tell us a story really quick.
Yeah,
that's a cool story.
You know what? I love starting with this company and being, as I say, kind of employee one, to build a culture of a great company. And the foundation of what we do, the concept, I can get behind that.
Yeah.
And then to build that culture. And so, I met with 2 of the founders a few weeks ago, 6 a.m. on a Saturday morning. Everybody's busy, and that was the open time.
Yeah.
So we met and said, okay, what are our values? What are we going to build this company on? And I was meeting with our Roswell team today, 2 of our physicians and front office and our MA. And just, we are so committed to who we're going to be. And so I was sharing this with them. And I said, guys, I want to share with you our values. Everything we're going to do is through this grid. And I want to make sure that if you see something in me and I'm not living these values, I want you to bring it up. That's
right.
who we'll be.
Yeah.
And so I wrote up on the board here, his HIPnation values. Number 1 is integrity in everything. That'll be the foundation, integrity. You can trust what we're going to do. Number 2, people matter. We think our patients matter. We think our physicians, our teammates, people matter. That's what makes this go. excellence in the details. You know, we just believe in striving for excellence. We're not going to be perfect, but we are always going to be striving for that. So I've got a team together of 5 folks, and I'm saying, look, we want to be excellent. If you have an idea to help us be better, call me.
Yeah.
Next, and then lastly was to make everything you touch better. You know, I love it. One of our founders said, I just love the word better. It's just a constant striving to be a little bit better. You know, 1% better today. Just keep doing that. Let's make everything you touch better. And so I'm talking to our team, and all of a sudden, one of our physicians who's sitting, I'm standing at the whiteboard, she just is burst out crying, is sobbing. And I didn't know, did I say something? And I looked, I said, Dr. Bush, are you okay? Did I say something? And she said, I have wanted to be a part of something like this for 30 years. Wow. I love that this is who you guys are, the founders, right? She said, I think how did we get to you guys? And she got up and gives me a big hug. And I said, hey, we think the same thing. How did we get physicians who are this passionate? You know, it's cool. In the office in Roswell, there's an article on the wall that over 20 years ago, the AJC did an interview with her about her passion for medicine and how the system wasn't allowing it and what she was doing to try to work around it 20 years ago. And I told her, I said, this is what we're doing. This is your vision.
Yeah.
We are producing what you wanted to do. And so, you know, when you get it, that's the group of folks we're attracting who are that passionate about building a great company, getting to take great care of our patients, recruiting other physicians, good physicians, no good physicians. That's fun for them to say, hey, I was just talking to one of our docs and was talking about in Savannah. He says, oh, I have a buddy who's a great physician down there. He's one of the best guys in Savannah. Yeah. I'll introduce you to him.
Yep.
I mean, now I walk into Savannah, Georgia, and I've got the best GI guy in Savannah because the best guy in Atlanta has said, hey, you got to talk to these guys. This is cool.
That's right. Well, so in our closing couple minutes, I want to say thank you to you because you and your partner, Brian, actually came out to Las Vegas and came to my think tank out there back when we hosted it for HIMSS. And so I appreciate that and you guys taking the time to join the think tank. You gave some great valuable perspective. And that was really one of the first times that we were actually able to kind of sit down and really talk. So in the theme of the think tank, tell my audience about the innovation and technology that you guys are deploying because you're in a really cool model and now it's enabling you to use all these great innovations out there. But spend about a minute on that, please.
Yeah, the neat thing about the model is when you really just say you're going to be just about healthcare, you can bring so many pieces of technology to the table that in the current system, the question is always who's going to pay for that? Mm-hmm. We take all that away and say, what are the things we can do? So quick example of one of our patients who's a type 1 diabetic, having his glucose level connected to his cell phone, which then gets sent to his primary care physician, who gave him a call one morning and said, hey, I see that your blood sugar is dropping at about 3 a.m. I want you to eat a half a sweet potato at about 10 o'clock before you go to bed. That doesn't happen in the normal system.
Not at all.
You know, that is technology that's out there. There are wearables now, you know, for less than the price of a Fitbit that can connect us with all sorts of information to our physician. You know, we were meeting with the founder of the company. He said, you know, our body is the best sensor around. We just need to be able to tap into all of that information. So pulling those things together, lots of different technologies via the phone, via the Internet of Things, and putting those things together. Again, just saying, look, if we put primary care physician and a patient at the center, how do we help leverage technology for that relationship? There's so many things you can do. Our EMR, where you connect the primary care physician and all the specialists, they're seamless. You know, you're not chasing down your records. You're not trying to get your, images burned to a CD that you take around or get things faxed here and there. All that stuff gets to go away because we change the system. We change the delivery model.
Yeah, and what's really cool is you guys not only do have the physical locations here around Georgia and obviously expanding to other parts of the state, but then also you're deploying, the whole telehealth aspect, secure messaging, patient portal, giving all your patients a personal health record. That's just, that's the future of healthcare. It's here today in a lot of areas, and you guys are deploying it.
Right.
And other practices haven't figured out how to embrace that, put that into practice because they're working in the old models of care. And so I just, I applaud that because I've been working 22 years trying to enable that in healthcare, and you guys are living and breathing it. So very, very cool. We've got about 30 seconds. So you mentioned already Columbus, Macon, Savannah. But where else might you guys be expanding? What other states maybe in the next year or two will you be expanding to?
Yeah, so we plan to be in Birmingham and Montgomery, Alabama. We've got some great connections there. Texas, Dallas, Houston, San Antonio. In Tennessee, we've got Nashville, Chattanooga, Knoxville. We've got some great connections up there, physicians who are ready for the model. And so we'll be into those states as well. The great thing is to build it in Atlanta and build it in a way that the physicians are happy with where we are, the patients are getting great care, and then we just take our model and go drop it into another state because we're free from insurance, so we can drop our model in, and we're healthcare.
Yeah.
We just take care of patients.
Yeah, no, amen. I think it's fantastic. Will, thank you very much for joining me here in studio. You're a great guest. I'm going to have you guys back. I want to have Dr. Hill join as well, and we'll talk about the clinical aspect because, again, what you guys are doing, you're living and breathing what I've been working on for so long. So I'm just so happy I came across you guys.
Thanks so much.
Thank you. And thank you to everyone for listening and joining us today. Please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific to hear our latest shows. And that's at thisjustinradio.com. And as always, you can track me on Twitter at HITadvisor and use the hashtag thisjustinradio so we can respond to your comments from this show. And if you missed any of this episode or want to hear more, all of my shows are posted at Apple iTunes, SoundCloud, iHeartRadio, Spreaker, Google Play, and TuneIn. And also you can check out the new website we just launched at justinbarnes.com. Thanks, everyone. Have a terrific week.